Good morning, everyone. Today is Thursday, December 21st. Thank you so much for joining into our weekly healthcare reform webinars. We do have a lot to talk about, before our Christmas and holiday weekend, but just wanted to thank everyone again for joining in. And also, if you want to ask questions, for those that are new to the format, you can do so in one of two ways. You can type in your question in the question box and I'll read them at the end of the webinar, or you can raise your hand icon. It's on the control panel to the right of your screen, and I'll unmute you at the end of the webinar and you can ask your question live. So just with a show of hands, since I always struggle with technology, if you could just let me know if you hear me okay and see my screen. Excellent. Perfect. Thank you, everyone. Okay, so let's get into the agenda. First things first, new administration. The tax bill passed the House, the Senate, and then the House again. So it is heading to the President's desk for signature. There should be no qualms about whether he'll sign it or not. The President will absolutely sign it. When he'll sign it, it seems to be either before the holiday or after the holiday, after the new year, but make no mistake, it will be signed. Within that bill is the elimination of the individual tax penalty. So that's huge. That's huge for all of us in this health market. It doesn't eliminate the ACA and, the parameters that the carriers have, but it will hopefully ease up the carriers to offer plans that, don't necessarily meet the ACA guidelines, because let's face it, there will be no penalty one way or the other, whether they meet the guidelines, have the coverage, or have qualified coverage or not. So that's a huge thing. That is set to take place in 2019. So what else is in there? There's a lot in there, but I did go through an article that just came out this morning from CNN. So it is a little bit skewed to the left, but it does have some good information. If you want to email me, I'm happy to email you the link for the article. But things that are important for you to know relative to this marketplace: none of this will affect your 2017 taxes. The changes will be first applied to the 2018 taxes. So it is what it is. Things will not change for this year. The tax penalty will still remain in place, and taxation as it is for 2017 will stand as it is or was prior to this bill. You can still deduct medical expenses. Many of you remember when the ACA was signed that the medical expense deductions went from 7.5% of adjusted gross income to 10%. It is now back to 7.5% within this tax law. That's good for everyone, again, to share with their clients in this marketplace. This is something for all of us, and I think that it's something you can share with your clients. It's not, specific to the health market, but the 529 savings accounts, you can now put up to $10,000 away pre-tax, not only for college expenses, which is the current law, but the new law also allows for parents to put money away for public, private, or religious elementary and secondary schools. So again, I think that's a real positive for those of you out there or your clients that are taking advantage of the 529 system. And of course, we talked about the mandate. The elimination of the individual tax penalty does not go into effect until 2019. So again, anything that's in place now, any plans that are in place, any penalties in place now will be applied. This is one that many of you in every state that does business with not-for-profit carriers, there is a provision within the tax bill to rein in the executive salaries for not-for-profit agencies or carriers, and employers. It is a 21% excise tax on salaries above $1 million for not-for-profit businesses. So thought that was kind of pertinent to our area. and wanted to share that. So there's a lot of stuff in there. I certainly don't pretend to know everything about what's in there, but there are definitely important things that will change the way we do business next year, moving into 2019. Again, I don't know that it's going to have any effect on any rates that are out there now. It certainly wouldn't have any effect on 2018 rates, but when the carriers go to file for their 2019 plans, hopefully they'll be given more direction and some latitude to offer some non-ACA compliant plans, both in the group market and the individual market. So we'll see what happens. So speaking of this market and new things, the reference-based pricing models have been gaining popularity in this area. It's certainly something that, from the West Coast moving over to the East Coast has experienced and taken advantage of, but it is something that's gaining traction again in our area. So on the 24th, we're going to have a lunch and learn. We're going to talk about the advantages of reference-based pricing. It's going to be hosted and conducted by Starmark, and it is a lunch and learn. So if you have any interest in learning about this, and I encourage you to do that, if you're in the group market, I think this information is certainly innovative and definitely relative for anything that you're going to be doing in the new year. So hopefully you'll take some time and register for that lunch and learn and come in and learn all about reference-based pricing. Highmark submissions, your Highmark group submissions, they are due at our office by 10 a.m. tomorrow, so we can process them. I mean, technically they're not due until the Wednesday after the holiday, but we are out Monday and Tuesday in observation of the holiday, and there is just no way if we get them in on Wednesday that we're going to be able to get them over and all missing information in time to secure those that 1/1 effective date. So if you have any Highmark submissions that you are planning on sending for 1/1, please be mindful and get those to us by 10 a.m. tomorrow. Aetna sent out a high volume letter to all the brokers and new clients to help set proper expectations. They said that the 1/1 2018 AFA clients will not have their ID cards by their effective date. Brokers, they're suggesting that brokers advise their clients to fill any maintenance meds now with their current carrier before transitioning to Aetna for 1/1. They had huge volumes, and I guess it's just taking them time to get through the volume. And they said once the case has final underwriting approval, if employees need to access covered services prior to receiving their ID cards, please instruct them to use the copy of their election enrollment form. So some information there from Aetna. It is in our newsletter that will be coming out in about 20 minutes. So if you have Aetna clients that are still waiting for their ID numbers and cards, you might want to take a look at that article in my newsletter. So Highmark and Milton S. Hershey, Penn State announced a strategic partnership. I did attach the talking points, in our handouts. I won't read over all of it, but essentially they're developing a value-based community care network, including new facilities to ensure patients and members in Central and South Central PA are in close proximity to PCPs, specialty care, and appropriate acute care hospital settings. So they are going to have a joint venture, and it's not only going to be facility-wise, but network-wise, and they're going to offer value-based coverage as opposed to paying fee-for-service. They're going to, really pay for the service itself as a whole, as opposed to each service being charged. So in theory and in practicality, there will be some savings for folks that are part of this joint venture. A lot of concern and a lot of talk in Washington about the continuing resolution to continue to fund the government, so it will not shut down at midnight tomorrow. And just so you know that in Pennsylvania, Governor Wolf did sign the House Bill 1388, and CHIP was reauthorized in Pennsylvania through December 31st of 2019, or 90 days after federal funding for CHIP ceases. And it allows for an extension if the federal government authorizes funding beyond December 31st of 19. So the continuing resolution is supposed to address that. Hopefully they will get to that. But Pennsylvania is pretty secure in our CHIP programs, and I certainly can't answer for other states, but we're pretty good where it comes to CHIP. No concerns. But again, hopefully our legislators that we've elected will do their job and get this done, so that we can at least be secure, or the parents can be secure in their CHIP coverage for their children. UPMC billing notices. So the December billing for UPMC, it looks like a number of invoices were sent with $0 due, and those clients will receive it was for their month of November for their December 17 coverage, $0 invoices. The clients are going to receive new invoices on this week, so they should either have them now or we'll be getting them hopefully by the end of this week with the corrected amount. And Highmark attestation. So many of you know that Central Pennsylvania, Northeastern Pennsylvania, and Western PA Highmark requires an attestation. And not only do you have to certify on the FFM to sell individual and family plans on the marketplace, but they require you to certify to sell their plans off marketplace. An additional step is the attestation that they require. I did receive a huge list of folks that do have renewals and have done their FFM certification but did not complete the Highmark attestation. I emailed everyone that was affected by this. So if you are one of those folks that received that email, please take the time and do that attestation to secure that renewal stream. It might not be millions of dollars, it might not even be hundreds of dollars, but you guys fight awfully hard for that business, and I would hate to see you lose out by not completing one final step. So please look for my email and take care of that. And last but not least, don't forget that URL. If you do your business through us, your group business, we offer Federal Cobra, complimentary of URL, also complimentary the summary of plan documents / wrap documents, and also benefit notices specific to your group and the group size. So these are all things that we're offering to help you maintain that compliance, or your clients maintain that compliance. And you can again use these value adds that we offer to our agent partners. You can promote them as your own value adds and hopefully gain some customers. And a final note, URL is closed on Monday the 25th and Tuesday the 26th for the holiday. So wanted you to be mindful of that. So now we're going to open it up for questions, and it looks like we have a couple. So Len says, will insurers adjust their 2018 premiums in light of the Tax Reform Act? Len, I highly doubt that. In fact, I know that they won't, because 2018 is set already. The plans are filed and approved by the states and HHS. So I'm going to say with 99.9% certainty, no. When they file their plans for 19, which is in May, June of 2018, hopefully, again, they'll have more latitude to offer lower rates and some other options outside of ACA. Jay says that he would like to wish each and every one of you a very blessed Christmas and a happy and better 2018 New Year. Well, thank you, Jay. Same back to you and yours. And Len asks if the 529 is after tax, not before tax. Well, let me see. It says 529s in the past, funds invested in 529 accounts wasn't taxed, but it could only be used for college expenses. Now up to $10,000 can be distributed annually to cover the cost of a child to a public, private, You know what? I don't know, Len. It doesn't say, but I will look into that, and I will shoot you an email and let you know one way or the other. But it doesn't say anything on specific to the 529. So that's it. Those are all of our questions today. And as always, I truly appreciate everyone joining in. I wish you all a blessed holiday and a wonderful balance of the week. Hopefully you get some time off to enjoy with your family and your loved ones, and hopefully it's a restful and wonderful holiday for all of you. So Merry Christmas, Happy New Year, and Happy Holidays. Bye-bye.